Perfect. Well, welcome to another workshop, wellness workshop. Today we're going to be more interactive. We're going to teach stretches for lower back and hip pain, because I'm pretty sure that if not all of you, one or two of you have felt a little bit of hip or lower back pain throughout their life, right? And I'm sure there's millions of people out there on Facebook land and whoever else is going to watch this that is dealing with the same stuff. Now I'm going to put a disclaimer out there that these stretches are just supplements that are going to help you manage some of the discomfort you're having. It's not the fix to what's causing the pain, because a lot of times when we have any type of pain, whether it's neck pain, mid back pain, lower back pain, hip pain, shoulder pain, there's a structural problem underneath that's going on that a lot of people are not dealing with and not getting addressed. So I would always say, if there is discomfort going on in your lower back, neck, hip, wherever, you want to get a structural evaluation with a chiropractor to rule out, the underlying cause. But these stretches that I'm going to teach today are really more stretches you could do on a regular basis, just to kind of maintain a good comfort level, keep proper flexibility, etc. Sound cool? So you guys know that this is not going to cure the world. Does everybody understand that? Good. But it is going to help you a lot, because I've actually done this talk in a 3-minute video showing these exercises to people on YouTube, and I've had hundreds of thousands of views, and I've had so many people say, I did these stretches for a week and it's helped us a lot. So it does help, but it doesn't cure. But today what we're going to focus on is the lower extremities. So when we talk about the hips and lower back, obviously your lower back's here, hips are here. So we got to think about what muscles attach to the hips in the lower extremities that could affect the way the hips and lower back function. So that's what we're going to go over today. So if we look here, these are the different muscle groups that we're going to discuss. So the first muscle group we're going to talk about, which is a very common muscle that everybody knows how to stretch, but they're not doing it enough, and it's usually chronically tight, and that's the hamstrings, which is the back of your legs. So your hamstrings start at the butt here, and they go all the way down to the back of the knee. So that's a very long muscle, and when tight, it pulls on the hips, and it could cause changes in the structure of the hips and lower back. Quadriceps, opposite side of the body. Quadriceps in the front of the body. So we have hamstrings in the back, quads in the front. Quads, they're called quads because there's 4 different muscles that make up that group. So there's 4 different muscles. They're not 4 different stretches, it's one stretch for the whole thing, but it's 4 muscles that all attach at the front of the hips here and go down to the knees. So notice that most of these muscles are usually long muscles that could affect not only the hips and lower back, but it could affect the knee. So some of these stretches could even help people that have knee pain as well. Not always, but it could help it. Next are your glute and the piriformis. I put them together because the stretch is going to stretch both of them. But that's obviously your glute is your butt, and the piriformis is a small muscle, a lot of people forget about it, that attaches at the sacrum, which is the bone you sit on, and it's a small muscle that goes out to the hip right here. And that muscle does external and internal rotation of your hip. So it allows your hip to go like this. Got that? A lot of people forget about that muscle, and when tight, that could cause a lot of discomfort and cause sciatica, actually. Anybody ever had sciatica before? So that's when you have a nerve pain going down the back of your leg. Well, when the piriformis or the glute is tight, that could put pressure on that sciatic nerve, because the sciatic nerve sometimes on the structure of the people go underneath the piriformis muscle. So that's why if it gets tight, you get those shooting pains down the leg. Then you have your hip flexors. This is exactly what it sounds like. It flexes your hips. So a hip flexion is like bringing up your leg like this. So those are the muscles. I'm going to take this out here. Those are the muscles in the front of your legs right here. Those are the ones that, when contracted, they allow you to go this way. So if these are really tight, look what it does to my body. If I take this and I tighten it up, it goes like this to the hips. Anybody ever seen a posture like that on people? It's pretty common, because not enough people are stretching their their hip flexors. Now the question is, how do you think many people get that posture? What does this look like you're starting to do? Sit. How many people sit most of their life? A lot of people. So when I'm sitting at a desk for many, many hours, these muscles are going to shorten because they're not used as much. So when you get up every time, it's going to feel tighter. And if you're not stretching that, your body will adapt to that position. So if you're sitting for 8 hours a day and you're only standing for 1 or 2 hours a day, guess what your body's going to adapt to? The seated position. So now all of a sudden you're going to have really tight hip flexors. That's another group. The adductors and abductors are the basically like your groin muscles. Those are the muscles that allow your legs to come in and out. So that's another one. And then last but not least are your lower back muscles. There's superficial and deep ones. It's all the muscles in the lower back here are called your superficial ones, the one you could touch. Then deep inside around the spine, there's called your paraspinal muscles. You can't touch them, it's for too deep. Those are the ones that are keeping the strength and stability of the joints. So if they're unstable in there, you have a better ability or a higher risk for getting like blowing out your back. Like some people like say like, oh, I went to pick up a pen and my back blew out. Well, picking up a pen shouldn't be that aggressive to the body. So if you're blowing out your back when you're doing that, it's showing that there's a weakness in that spinal muscles. So those are the different groups that we're going to talk about, and they're all right here. So you have the gluteals in the back. This is the back of the leg. This is the front. So there's your quad. Everybody knows how to do it. They're not doing it enough. There's multiple ways you could do it. One way. So one way you could do it is on your back. So actually, do we have one of those green stretching bands? So this is this band right here. The feet right here. And what you do is you pull it up like this. You get how that would work? And what you're doing is when your leg is straight, this is an example. So it basically just goes out like this. Each of these little holes are for your feet. So I just usually just put it in the one closest to the middle. You take it, put it around this. And by the way, you can purchase these bands, I think on Amazon, for like $10. You just look up stretch out band or stretch out band, sorry. And that's something they can purchase easily. So basically what you do, you lift up your leg until you feel a nice stretch in the back of your leg. If you pull this toes towards your feet, you'll add in the calves. But if you don't want to stretch the calves, keep it forward like this and go back like this. And I feel a nice stretch in the back of my hips. That's a way you could do it with a stretch out band. If you don't have one of these, very easy way to do it is sitting in a bench similar to this. Put your leg out, reach out for your toes, grab the toes. Very easy. Everybody understands how to do it, but they don't do it enough. That's a common one everybody knows how to do. What I recommend, like, because people always like to have sequences and stuff, I usually recommend holding it for about 20 to 30 seconds and doing each leg 3 times. And you could do that multiple times a day. But at least it gives you a starting sequence. So 30 seconds, 3 times on each leg. If you want to do 30 seconds, 5 times on each leg, that's up to you. But at least it's a shorter period of time and you can get that done. So that's the hamstring. Anybody want to try using this? Or you'll do it another day? Want to try it? No? Okay. All right, so next, the quads. Another way with the hamstring, if you don't have a bench, everybody knows how to do this one, but I would recommend only doing this if you have a stable back, is just literally reaching for your toes. So you just go down, reach for your toes, and hold that for 30 seconds and do it a few times. Those are 3 different variations. There's variations of every stretch that I'm going to teach you. So one is with a stretch out band, one is lying on a bench, one is just being in the, wherever you want to be, you don't have a bench to lie on, you just reach down to toward your toes. I would just be careful that you're not straining your lower back. So your quads, front of the leg. You can see here, there's 5 different stretches right there. The most common one that everybody knows is just grab something for balance, grab the back of the ankle here, and just pull that towards your butt. If you're not flexible enough and you can't grab the ankle, you can grab the pant leg or put like a towel underneath the ankle and you pull that forward. Because everybody here is going to have different flexibility. Some people are going to be very flexible, some people are going to be rigid as heck. So everybody has variations. So you could always vary it by grabbing the pant like this. If you're really, really flexible, you could do something with the band as well, where you line your stomach, put the thing on your ankle, and pull the band towards your butt, similar to this picture right here. You know, this way you can get a little bit more, this guy has his knee on an unstable platform, so that would actually make it a little bit harder because not only do you have to stabilize yourself, but you're also stretching as well. Different variations, and I'm going to send you home with some sheets of paper with some different exercises, so you're not going to have to remember all these. But your quads, front of the legs. So, and the 4 quads, if you want to know what they are, it's rectus femoris, which is the huge muscle going down the leg. You got vastus, intermedius, lateralis, and medialis. Those are the 4 muscles if you are interested in knowing what they are. But they all are stretched when you're doing anything that brings your your ankle towards your butt. Got that? Any questions? No? Good. Now you got your glutes and piriformis. Now I put them together like I said because the stretches are very similar. Two variations. You can do it in a seated position or you can do it in a lying position. The lying position is on your back. You figure 4 your feet like this on top of here, and what you're going to do is you're going to go inside your leg, grab the back of the knee, and bring it towards your head. And you're going to feel a nice stretch there. You could switch to the other side, figure 4 that there, come underneath, and grab. If you want to take that same band and put it underneath here to pull, I mean, there's all different variations. That's the lying down variation. The seated one, which is probably going to be a lot easier for people, is literally in a seated position. You're going to do the same thing. You're going to figure 4 the leg over like this, and there's a couple variations. If you're very flexible, you might need to bring the knee towards the opposite shoulder. So what you're going to do is you're going to grab this like this, and you're going to come forward. Come across towards your opposite body. If you're not flexible in any way, you might actually feel the stretch just like this. And if you're in between, you might have to just put a little bit light pressure down on the knee like this. So everybody, like I said, is going to have different variations of stretching. So everybody's going to have different levels of how far they have to go. But the first and most easiest one to do is this one. The second hardest is pushing lightly down this way. The third hardest is bringing this towards the opposite shoulder. Like this one I really feel right in here. And then again, you can do it the other side as well. So pressing down or bringing it across the body. The importance is bringing it across the body because if you bring it up, you're doing a different muscle. So the importance is bringing the knee towards the opposite shoulder, like this. I mean, there's other ways of doing it in a seated position as well, but like I said, if you look these up, but that's the glute and piriformis stretch. Next is the hip flexors. So the hip flexors, the most common way to teach it is in a lunge position. I mean, everybody know what a lunge position is? So you're going to get into a lunge position in which, say I'm stretching my right hip flexor. What you're going to do is you're going to get down. It would be smart to put something underneath the knee, like a pillow or a towel or something, so you're not directly on the ground. I don't have that right now, so I'm going to deal with it. But what you do, I'm stretching my right hip flexor. So this leg, you're going to put out in front of you flat, and what you're going to do is you're going to lean into that front leg by keeping this down there. You're going to feel a nice stretch in that hip flexor. You understand that?
Is it important to keep your front toe straight?
Yes.
Or would that throw everything off?
You want to keep it straight and you want to keep it flat. You don't want to lift it up or you don't want to be on the heel. You want to keep it flat on the ground. And you're gonna get more of a stretch on that hip flexor the further out you step forward. And the big thing is you want to make sure your knee never goes in front of your toe. So if you're like this, you're putting more stress on the knee than you are on this hip flexor. So you want to make sure that you're always bringing the leg out enough that your knee is in behind the toe. So that was a good question, Megan.
And your torso should be...
And your torso should be upright. Like you don't want to go like this. You want to be upright like this. And like I feel an awesome stretch right there. And I might even feel a little bit of the quad there because I'm bending, the knee a little bit. But that's a great one. There's that version. This version is more of an advanced version. It kind of combines the quad and the hip flexor. Basically what you do is you go against the wall. You put your foot up against the wall. And you kind of do the same thing. You lunge forward. Except this one, instead of lunging your body forward, you're going to sit upright. Because the more you sit upright with your leg back at that wall, the more you're going to feel all of this stretch. That make sense? Yeah, that one's a little bit more advanced. I wouldn't go to that unless you're ready for that one. And then if you have somebody helping you stretch, a way that we do it here in the office is the person could lie on their stomach and they could actually pull up so they're going to bend the knee and pull up from here so that they're doing something like this to you. And that's if somebody's helping you, but half the time we're not having somebody help us. So it's more like us doing it. So that's your hip flexors. And that one, I would say out of all these stretches, they're all important. I would say out of all these stretches, the ones that cause the most havoc is the piriformis and glute and your hip flexors. Because they're little muscles that really mess with the whole pelvic movement. Obviously hamstrings are important, quads are important, etc. But the ones that are the most forgotten and the ones that have the most damaging effect to the hips and lower back is your hip flexors and your piriformis and glute muscles. There's another muscle, which I don't think we spoke about, on the side of the knee here, called the IT. Well, the tensor fasciae lata is the muscle up here in the hip, and then there's a band that goes down the side of the side of the leg that goes to the knee called the IT band. That's very commonly tight in runners, if you're a common runner. And when that gets tight, it causes a lot of knee pain on the lateral side of the knee. So that's another one. That one's a tough one to stretch. You actually have to kind of find a wall to stabilize, and you kind of step over your leg like this, and then you lean in this way. So you're stretching this whole side. It's a tough one to stretch, but that one also causes a lot of hip and knee pain for people. It's funny, the smallest muscles cause the most havoc. The bigger muscles are not as dramatic on the body, because they're focused on more other things like moving full joints, not so much of the other stuff. So now you have your lower back muscles. So we have your deep muscles and your superficial muscles. We're not going to go over them all, but there's muscles that even attach up at the shoulders that even attach to the lower back. So you have like your lat muscle that attaches up here and goes to the lower back. So a lot of times if our lats are not loose or very tight, that could pull in the lower back. Then you have your deep muscles in the lower back. So a common stretch, you could either do it on your stomach right here, where you basically are just going to kind of crouch over like this for your lower back, where you go like this. You can hold that. You could even go from side to side. So you could start in the middle here. Then you could go to the side to get more of the side here. And then you could go over here, more of the side over there. That's a way you could do it. Or if you don't want to get on your knees, you could go on your back. You could do one at a time, where you bring this towards your chest. You could bring one up, the other one up. You could bring both up. If you have knee pain, you could come underneath the knees and come up like that. So there's multiple variations of that. If you're on a yoga mat or something, you can do, I would be careful with it because you don't want to rotate too much, but you could do the one where you rotate over like this. So you could stretch that way. You might even hear a release of the joint when you do that one, as well as this one. You want to be careful with twisting movements because you don't want to damage the spine. But yeah, there's a lot of little muscles and big muscles in there that we're not going to go over and stretch every single one. But when you're on your stomach going side to side, you're going to add in the lat muscle, the quadratus lumborum, all those muscles in the lower back that a lot of people forget about.
Is it important to stretch after an activity as well, or should you let your muscles recover?
Stretching, you're going to benefit the most with stretching from doing it often throughout the day and not just with activity. Mm-hmm. So a lot of people, they just stretch when they're going to work out, or they just stretch when they're going to do some type of sport or activity. And it's helpful, obviously, because it's going to make you looser, but you're going to get the most benefit and the most relief when you're doing it on a regular basis and not just doing it for activity.
Right.
So, but yeah, stretching before an activity is going to be important because it'll help you loosen up from that. And typically you don't stretch as much after the activity as much as before.
Is that because you need to recover, or
you're already loose? You're already loose.
You've
Been doing the activity, you're already loose. But these type of stretches, I'm recommending doing on a regular basis, more than just I'm having a softball game tonight, so I'm going to stretch my hamstrings and my quads. Because pretty much the extent of most people stretching is I'm going to stretch my hamstrings and my quads, and I'm already done. Right. They don't even think about every other muscle. We didn't even talk about the upper body. We'll talk about that when we start talking about shoulder and neck pain. But there's so many other stretches that you can do for that. So those are definitely some of the more important stretches that you should do on a regular basis. So if you're doing 30 seconds 3 times on each side, you're not asking a lot of time. So you could do this whole entire stretching routine. I'm not going to even try to do the math. What is it, 15, 20 minutes? You're not looking at hours of stretching throughout the day. You could literally wake up in the morning before you do anything, before you even brush your teeth, stretch for 15 minutes, then go brush your teeth. And then right before you go to bed, you had a long day, right before you go to bed, you're going to lie there for 8 hours for a night, or 6 hours for a night, however long you sleep, stretch before you go to the bed. So then at least when you're waking up and when you're going to bed, you're getting those muscles to relax.
Is that the overall science for stretching, or is it about bringing blood to the muscle or anything like that? Like, what is the complete science of stretching?
I mean, that's a deep question. I'm not even sure if I know the full science behind it, but it's just that we do so many things to our body to tighten us up. Like I said, sitting at a desk for a long period of time, driving in our cars for a long period of time. Even some of our, I mean, you're a painter, so you're putting yourself in all crazy positions for an extended period of time. So the muscles are trying to adapt to that, but that's not always the best position to adapt to. So you just want to keep a nice, flexible, mobile body because your body lives for motion. The more that we tighten up, the more that we get restriction in the body, the more our body breaks down. So it's more about just keeping a mobile body. You know, and like I said earlier, a lot of these muscles are tight chronically because of an abnormal structure. So you got to think, if I have an abnormal structure, let's just say I have a shift in my posture in my lower back to the left. So my body looks like this. There's a lot of people that have that and they don't even realize it. It makes sense that my muscles would be pulling more on one side versus the other. So chronically, those muscles are going to be stretched. Now I could sit there and do these stretches all day long, but if this structure isn't addressed, there's a big component not being capitalized on. You know, and when we look at the side view of people's spines, I mean, we're supposed to have normal curves in the lower back that go backward, and the neck that go backward as well, and the shoulders come slightly forward in the mid back. If we lose those proper postures, you know, let's say the hip flexors are super tight and they're pulling you forward like this, or if your glutes are very tight and it's pulling you this way, they're going to be natural structural changes that is happening to the body. So the result of the abnormal structure is chronically tight muscles, but the solution is fix the structure and work on the muscles because they've been tight for so many years. So I don't recommend just doing these stretches. I recommend doing these stretches with a structural rehabilitative program, which is why we're doing the stuff we do in the office here, and then we're teaching you things to do at home. Make sense? Any questions? Anybody want to try any of the stretches? Make sure you do it right.
I want to try the side one,
Which one?
which would be like a hip pointer.
Like
The
where?
one that you said was the hardest one to try to get at.
The T-band one?
Mm-hmm.
That's a tough one.
Because that's where I'm experiencing all kinds of weird stuff.
Okay, so it would be better if we had a wall to lean into. So let's see if I can move this. Come on over here. So what you're doing, let's just say we're stretching your right IT band. So what you're gonna do is you're gonna step over this,
So I have to face this way.
and you're gonna just lean. But you want to kind of hold on to one. You're gonna lean into.
Kind of lean into the wall.
No, the other way. That way. So look at me. Step down like this.
All right.
A little bit. See how far I'm apart? There you go.
All right.
And then make sure you're straight good, and then lean into this side. You feel a nice stretch
Yeah,
through here.
absolutely.
Make sure you're leaning with the hip and not your back. So stay up straight and lean in there. It's a hard muscle to get.
I would definitely
It
got
might
it.
be easier if you flip them around. So
And do it the
it's
other way?
Going towards the.
Yeah. I just didn't want it to hit the television. That's
I'm
all.
on TV. So it'll be the same way.
And then you just lean into the wall.
Mm-hmm.
There you go. That's a tough one.
It is.
You know.
It
there's
is. It's hard to
probably-
get.
and
It's
that-
hard to get at.
Yeah.
It is hard to get at.
I would probably say that's one of the hardest ones. And
Of course,
unfortunately-
that's my life.
Yeah. But yeah, that's the one that it causes havoc on runners. And a better way to do it, which is even more uncomfortable, is to roll it out. So you ever heard of a foam roller, right?
Yeah.
Grab me a foam roller. If you have a foam roller, you can actually roll out your hip and IT band by yourself. So what you do is you grab this, you're gonna put this on the floor like this, and say we're getting our right side here. You're going to put that foam roller on the side of your hip like this. You're gonna come up on here for stabilization, and what you're gonna do is you're gonna roll that up till you find a nice spot that's nice and tender, like about right there for me. Just hold it for like 5 or 10 seconds. Then you're
So
gonna
once you
go-
find that spot,
and then just hold it for a couple
Hold it.
seconds. But then you're gonna go to another one because this whole IT band is gonna be tight on a lot of people. Some might have it more up by the hip, some might have it more in the middle, some might have it more by the knee. But you find that spot and just hold it for 5 or 10 seconds and then do the other side. Ugh. Yes. And there's also ways of doing it on your hamstring, your quads, any muscle you can roll out. But stretching is a good start, and then you could go on to the other things. But any other questions? Did I hit anything that somebody was like, I should be doing that. Everything. So I have some sheets for you. I have 2 separate sheets because we found 2 cool ones. One are more advanced than the other. Some of them are ones we showed, some of them are different ones. So these are probably more of the advanced ones. These are probably more of the easier ones. So just take one and hand them the other. Those are some stretches you could do on a daily basis. But like I said, my start is 30 seconds 3 times on each side. You can add as many sets as you want and hold it for as long as you want. But the best and most effective way to stretch is doing repetition and not just doing it one time. So you don't want to just stretch for 30 seconds and then it's it. You want to stretch for 30 seconds and do it multiple times throughout a day. That's when you're going to get the most amount of effective results. Any questions? Because if not, that was perfectly timed. 30 minutes, ready to rock and roll. Any questions on the Facebook? Awesome. All right. Well, thank you for another workshop. If anybody wants to stick around and I could show you some stretches, and if you have certain muscles that you're wondering about, it's a good start. We can talk about that as well. But if not, you guys are awesome. So is Facebook, so we'll see you soon.